Hey guys, here with Clarky again today. So she just had her post-op review on Monday with her surgeon. So how'd that go?
It went really, really well. So the first up question I asked him before we even got into his room was, can I take the brace off? And he was like, yes. So that made me really, really happy because I was feeling very restricted and weighed down by that brace. He was pretty happy with everything. He said the extension was good, and which was a nice relief because that's what Nathan had worked really hard on before the surgery and what we were a little bit worried about. I was a little bit worried about the flexion range, but he was happy with that as well. He said just keep working on it. So yeah, really, really good.
Yeah, okay. And he was completely happy, full-time out of the brace.
Yeah, he was like he could have taken it off days ago, and I was like, just making sure, but he was like, he asked me if I was going to burn it. I did tell him no, just in case we needed it again, but I can't see that we will.
Yeah, okay. And then coming back to work, so that was one of the questions you were planning to ask.
Yeah.
What's happening there?
He was happy for me to go back to work, just making sure that I was being careful not to cause any damage to that graft.
Yeah, okay. And so what are the things in particular he wants you to work on?
So his biggest one was the flexion range, to keep working on that because that's obviously the bit that needs the most work out of everything. So obviously that's the biggest thing, and then working on the extension just a little bit, but being very, very careful not to hyperextend it and damage that graft, and just start working on that muscle build up a lot as well.
And so how long to go see him again?
4 weeks today.
4 weeks today, okay. And so we've progressed our rehab along, sort of increase the intensity of the exercises and everything like that. How have you found that change from the physio side of things?
It's been a little bit hard, mostly because trying to work out which exercises and stretches to do when, because some of them were standing up versus some of them were sitting or laying down. So just working out how to pair them together to make it more time manageable, I guess. I'm not a huge fan of walking without my one crutch just yet. It's more of a mental block than anything else. I know that I can do it, but it's a bit of a safety blanket, so I still want to hold on to it. I have to be a little bit aware. We have obviously Tonks. We also have 2 cats as well. So some of the exercises involve me having to close my eyes. We had a little incident where Tonks decided to jump on me while I was doing it. I didn't fall over, thank goodness, but yeah, just being aware. So like those sorts of things, just playing on your mind. So yeah.
Yeah, okay. And so we've got a little machine that we use to help try and build those muscles up, in particular the quads. So give us your thoughts on that and how you found using that post-op.
It has been helpful. It's woken up, I guess, muscles that have been a little bit dormant for a while, so now I can feel them moving, which does feel a little bit odd walking around and doing the exercises that suddenly there's feeling where there wasn't beforehand, but it's definitely been helpful in that regard. The muscles are there. It's not, they haven't just disappeared completely. So
because I know you mentioned to me post-op that you felt that there was a big difference in muscle strength and size between both sides. Do you feel that's helped catch that up a little bit quicker?
My left leg has been overworking, compensating for the lack of on the right side, but it is starting to even out a little bit. Like I still have to focus on actually putting weight on my right leg.
Yeah, okay. And so any words of wisdom for anyone who may have just had that ACL done? Let's say someone's just had their ACL done today. What tips would you give them for their first 2-3 weeks? Do
exactly what your surgeon and your physio team are telling you to do. That's what they trained for. They know what they're talking about. But at the same time, be very, very aware of your limitations. So do as much as you can, but don't overdo it because you will damage the graft inside, and that's the last thing that you want to do. And I guess just don't feel that you're useless if you have to sit around for those 2-3 weeks with your leg up doing nothing. It's what your body needs for it to heal properly.
Nice. Okay. So what are your goals between now and when you go see the surgeon next?
Getting that flexion range, that's important to me because it's noticeably different between my left and my right legs. So, and just building up that muscle because that will make me more confident in the exercises and just general movement.
And I think particularly probably with walking.
Definitely with walking, yeah.
Yeah, okay. So I might catch up again in a couple of weeks, maybe just before we go back and see the surgeon again. Check in, see how you're going with the strengthening program, everything like that. And see where we're at. We might try and give a little bit of a snapshot of what we're doing in physio.
Yep, easy.
Yeah. All right, have a good week, guys.